My name is Carolyn Taylor, and I'm the founder and president of Global Focus on Cancer. GFC is a 3-year-old US-based 501c3 nonprofit organization that acts as an agent of simple and effective change to help reduce the global burden of cancer. We do this by creating, implementing, and sustaining cancer awareness programs and cancer support groups in areas where access to information about cancer is critically lacking. Cancer is a leading cause of death worldwide. In 2012 alone, there were 4.1 million new cancer cases and more than 8 million cancer-related deaths. Every year, more people die from cancer than from AIDS, malaria, and tuberculosis combined. More than 60% of the world's total new annual cases occur in low and middle-income countries. These regions account for up to 70% of the world's total cancer deaths. 50% of cancer in the LMICs occurs under the age of 65. This leads to an avoidable loss of productive life years. Due to this extremely high burden of cancer in these countries, there's an enormous need for programs in cancer awareness, prevention, and support. GFC has developed an evidence-based, locally adaptable cancer awareness program that we deliver directly to factory workers in order to address the issues of late diagnosis and cancer prevention. We've entered into a multidisciplinary partnership with the outdoor clothing company Patagonia, their local affiliates, international and local cancer control experts, local health NGOs, and public sector facilities. Components of the program include training and capacity building for factory workers, the development of a resource library within the factory health center that will provide information about specific cancers, screening, locally available and affordable treatment options. We'll also train a group of workers to act as ambassadors and peer educators. They'll be responsible for distributing literature and maintaining the resource library in the health center. We use flipbook-style presentations that provide basic, useful information about cancer prevention, detection, and treatment. The presentation is delivered in the factory by healthcare professionals. We contract with local healthcare NGOs to implement the program. The program includes information on causes of cancer, types of cancer, general risk factors, truths and myths. We address cancer prevention and early detection methods. We gear to very specific statistics to the target audience and the country that we're working in. We have information on nutrition, exercise, lifestyle, and behavior modification, as well as survivor stories and photos in an attempt to really humanize the cancer experience. In terms of monitoring and evaluation, we'll administer pre- and post-testing to a random sampling of participants in an effort to measure knowledge change. We'll also attempt to gather data on smoking prevalence and attempts from the workers to access cancer prevention and screening services. If needed, all these tests can be administered verbally by health workers. In terms of the expected outcomes, factory workers will have a solid foundation in basic facts about cancer. There'll be a decrease in stigma and myths surrounding cancer. Workers will be encouraged to access early detection and treatment services. And hopefully there'll be an increase in adapted, healthier lifestyle choices, and that will lead to reduced absenteeism and overall healthier and happier employees. In terms of GFC's financing, Patagonia has agreed to pay for the implementation of the program in their factories. Our costs are raised through local fundraising and grants. We're launching our pilot program in mid-2015 in Hanoi, Vietnam, in 3 factories where Patagonia manufactures. Our ask for the panel is how can we build our financial and partnership resources in support of the program? We need additional funding to sustain and scale our work. By having this opportunity to present our program in front of the audience at the conference, we're hoping to broaden our partnership possibilities as well as to expand on our donor and volunteer basis. Thank you so much, and we'll see you in March.